So, so one of the things we talk about is care for the caregiver. So, Donia, did you ever have a discussion after, everything kind of got over with your daughter, husband, about kind of what they went through? Did they ever share back?
Yeah, I was asking my daughter what was her experience before I came here because I never really had. She said I was grumpy. And then I had another
Sure.
friend. She said, I asked, just getting ready because I thought you might ask me this, what was your experience of me, a close friend? And she said, you were in denial a lot. That's what she said.
We
So.
were like, oh, I didn't think that was going to. I think, were those the answers you were expecting?
I wasn't judging. I know I was grouchy. I'm sure I was.
Hey, completely understandable. You didn't think so?
Not a single day.
There you go. Great distinct. So, Dr. Eskander, what do you think? Like for the caregiver, what are your thoughts on that?
I think it could be hard on the caregiver. I've seen caregivers where sometimes the visit will be done and the caregiver will want to sit down and talk to me after the visit because they're struggling and they don't know how to deal with some of the issues that come up in the conversations they have with their family member. A lot of times it'll be the visit's over and they say, oh, can I speak to you outside of the room for a few minutes? And I have to talk to the patient and see if it's okay.
That's a little challenging always because,
But it's tough. I mean, they're scared. They're just as scared, if not more scared than the patient. They don't have control. Sometimes they worry about if they're helping or hurting with the things that they're recommending or how to answer questions that are posed to them. So it's really tough. And sometimes the caregiver can get overlooked because the focus is on the patient. But hopefully, as they navigate the process, they can find a way to, again, in this kind of happy equilibrium until we get through treatment.
So, Dr. Hurst, what do you think? Care for the caregiver. How does one address that in the psychological aspect of that?
Very important. We find that if family members are well cared for, they're better able to help our patients, and the patients do better. I mean, it can be extremely stressful for a patient's loved one because I think they see the person as having this crisis go on and sort of feeling unable to do much about it. They're not the ones prescribing the drugs. They're not the ones infusing the chemotherapies or going through the surgery. That often I hear a sense of somewhat helplessness and what can I do? So being there for the caregiver and hearing these thoughts and normalizing them is often all that is needed. But if they need more, making sure that they get their own psychotherapy or their own psychiatric help is critical. And allowing for some open dialogue. I think a lot of times, but in relationships, the relationship is seen as changing. One thing we haven't talked about is issues with intimacy and feelings of sexuality or femininity can sort of change, and that can be hard for partners to know how to navigate and talk about and normalize. So allowing that, if that is a concern that has come up to be discussed, can make it a little easier.
I think that's very, very, very important. So, Donnie, I don't want you to be on the spot on that. Did you have those discussions with your family, with your husband, and everything about what you guys were going through?
Yeah, I'm just kind of learning now how they processed it. I think they kept a lot of that to themselves, and so it's more of a dialogue where we go through now. But I think in general, they're very happy. Things are returning to
normal.
Yeah.
Seeing those movies again. Although we never stopped. You never stopped seeing the movies.
We never stopped seeing the movies.
You're right.
Yeah.
On every Friday and everything.
Yeah.
That's actually an amazing thing to have, that you guys can go and just spend time in the movie hall. So, Dr. Eskander, I'll end with you. Where do you think the field of ovarian cancer is going? Where is it right now, and what is your projection? Back to the future, no, not back to the future, but in the future, when you look at 10 years, a decade later, there's so much happened in the past decade. Where do you see that field going?
It's probably, I would say, the most dynamic time right now compared to what it's been historically. We have several clinical trials that are active and running. We've had multiple FDA approvals for drugs that we hadn't had an approval since 2006, I believe it was. And then from 2014 to 2019, we've had, if I remember correctly, 10 FDA drug approvals in ovarian cancer. So it's been a really exciting time because with each approval, there's an opportunity, and that opportunity could benefit a patient and could prolong their life with this disease. We have several studies that are looking at novel combinations of drugs, PARP inhibitors plus other drugs to try to improve on outcomes. So we're at a really amazing time because not only are we moving this kind of therapeutic needle forward, we're also understanding more about the molecular aspects of these cancers and combining both the molecular data with the therapeutic data to try to match and help our patients live longer, if not cure some of them. We haven't used the word cure in ovarian cancer as far back as I can remember. And now with the data that came out with SOLO1 and BRCA mutation patients and these novel combinations, and we're looking to see, can we get rid of chemotherapy altogether in a subset of patients? And that's something that, God, we would have never discussed that a few years back, but it's really an unbelievable time. And our hope is to be able to cure more of our patients and to be able to help patients who are suffering with the disease live a much longer lifespan with a good quality of life.
That's amazing. I think so. Exciting times ahead. Donia, Dr. Eskander, and Dr. Hurst, thank you so much for this great discussion on this program. We really appreciate it. Thank you.
Thank you.
Thank you.